The UK is at a dangerous moment, according to England's Deputy Chief Medical Officer, who urged people not to tear the pants, as he put it, out of the loosened lockdown restrictions that will come into effect from Monday. Professor Van Tam today reminded people of how rapidly the disease can spread throughout the population. Many people have been tempted out by the warm weather once again today, as some members of the government's own SAGE advisory group spoke out against the pace at which changes to the lockdown are coming into effect. Well, the government announced a further 215 deaths recorded in the UK, bringing the total number of deaths of people who've tested positive for the virus now to 38,376. Our political correspondent Chris Mason has more.
Helens Bay Beach in County Down today. In Northern Ireland and in Scotland, groups are already allowed to gather outside. England and Wales will follow on Monday. New rules grant us more freedom, but require us to make more judgments about what is safe. In Bournemouth, the lure of the beach, the challenge of social distancing. In York, the prize of a pint, and yes, exactly the same challenge. With the number of coronavirus cases falling, ministers say the time is right for a more liberal approach. But some of those advising our political leaders have concerns.
If we make multiple releases of the lockdown at the same time, we won't know what is causing the inevitable jump in cases. And we don't have an established test, track and isolate process to follow these people up. So we're at a very risky point where we could take the lid off a pot that is still bubbling in places, and it risks overflowing in these places.
Regent's Park in London earlier, and Primrose Hill too, as the Labour mayors of London and Greater Manchester also worry loosening the rules has come too soon. So at this afternoon's government news conference, I asked, what do you say to those scientists and others who say that you're easing the lockdown in England too quickly?
We haven't got that much headroom. That's why the Prime Minister has been clear that we need to proceed in a very cautious way.
I believe, and you'll recall I was at the podium when the disease activity was very high in the UK, and I said it's a very dangerous moment. I believe this is also a very dangerous moment. We have to get this right. The public in general to actually follow the guidance, don't tear the pants out of it, and don't go further than the guidance actually says.
Professor Van Tam knows how to turn a phrase and make a point. He was also asked directly about Dominic Cummings, the Prime Minister's most senior advisor, who, among other things, drove 50 miles to test his eyesight during the lockdown.
The rules are clear, and they have always been clear. In my opinion, they are for the benefit of all, and in my opinion, they apply to all.
Questions about Mr Cummings keep coming. Questions about easing the lockdown will too. Chris Mason, BBC News.
Well, let's turn to matters of health then with our health correspondent Catherine Burns, who's with us now. And tonight, new guidance for those people considered extremely vulnerable.
Yeah, this is for anyone who's shielding in England. So these are the people who have a specific medical condition, which would mean that if they did get coronavirus, they'd be more likely to become very ill. There are 2.2 million people doing this in England right now. And if you think some of them will have had no face-to-face contact with other people since this started 10 weeks ago. But from tomorrow, the guidance is being tweaked in a small way, which could make a really big difference to their lives. So they will be able to go outside with someone they live with. If they live alone, they'll be able to meet up with one other person. Now, this is only once a day, and they're not to go to shops or work or anywhere where it would be impossible for them to do social distancing. So why is this happening now? Well, the government says it's because the chances of getting infected have gone down. So when this all started originally, the chances of someone getting infected were about 1 in 40, they say. Now that's more like 1 in 1,000. The government also says it will look every few weeks at the restrictions to see what it can do to make life that bit more bearable for people who are shielding. The Prime Minister's thanked these people today. He says their patience and sacrifice has saved thousands of lives.
Catherine, thank you.